Welcome to Cancer Episode 3. In this section, we aim to provide you with useful nuggets as it relates to three relatively common types of cancers. Breast cancer is the most common type of cancer in the UK. Bowel cancer is the fourth most common cancer in the UK and the third most common cancer in the USA. And pancreatic cancer is the 10th most common cancer in the UK, accounting for 3% of all new cases of cancers between 2016 and 2018. Among females, it is the 9th most common cancer in the UK. We will revisit Hungary and Uruguay as they had the highest overall rate of cancer in 2020. We also note that Hungarians are the mainly meat eaters, where pork is the dominant meat ingested. Uruguay has one of the highest red meat consumption in the world, so we'll also visit that country, looking at its cancer incidence also. Now we talk about breast, bowel, and pancreatic cancer in this episode. There's a true story at the end of the previous podcast of two individuals experiencing the same type of breast cancer. One died 6 months after her diagnosis was made, the other is still alive some 4 years on. There's an important lesson in this story. You may ask, why do we focus on breast, bowel, and pancreatic cancers? Apart from the frequency with which these cancers arise in Western society, they help to illustrate one of the discussions earlier in which it was made clear that cancer arises from any cell in the body. And seeing that there are in excess of 300 trillion cells in our bodies, cancer can arise from any of these cells. Nonetheless, it is noted that despite originating from individual cells, we speak of the cancer as it relates to a specific body organ. It tells you that the cancer is simply named according to the organ from which the first cell became malignant, and it's on that basis we talk about a primary cancer. The primary cancer being the organ in which the initial cancer cell developed. The choice of breast, bowel, and pancreatic cancer. These three cancers were chosen for discussion not only because of the incidence, but also these cancers differ in the difficulty of detecting them from symptoms and signs which they present. It allows us at Phillip Academy to provide you with special life-saving nuggets that assist you in protecting yourself from common cancers. We look at the changes they bring about, changes that one may be inclined to ignore if not aware of the significance. These three cancers were chosen for discussion not only because of the incidence, but also these cancers differ in the difficulty of detecting them from the symptoms and signs with which they present. It allows us at Phillip Academy to provide you with special life-saving nuggets that assist you in protecting yourself from common cancers. We look at the changes they bring about, changes that one may be inclined to ignore if not aware of the significance. In breast cancer, for example, one recognizes that the breast is easily accessible, and simple self-examination of a breast, men as well as women, I repeat, men as well as women, may be, when you go to the shower, can help to save your life. If, for example, you find a lump, you can seek medical advice, and unlike Sister A, who was dead within 6 months of her diagnosis, we can behave like Sister M, who is still here 4 years after the diagnosis. Signs and symptoms of breast cancer. Signs and symptoms of breast cancer include the presence of a new lump in the breast or armpit, thickening or swelling of parts of the breast, irritation or dimpling of the breast skin, a feature which looks very much like orange peel. We sometimes refer to it as peur d'orange. Forgive my French. Redness or flaky skin in the nipple area, puckering or loss of the breast symmetry, nipple discharge excluding milk. That is to say, if you see milk coming from your breast, you can reasonably ignore it. If it's anything else apart from milk, blood specifically, you need to seek medical attention. Pain in any area of the breast could also be a signal that there may be something wrong and you may need to seek medical advice. These features, though, are not exclusive to breast cancer. I hear you ask, where are we now? Where are we now? Some gene mutations such as BRCA1 and BRCA2 increases the risk of breast cancers as well as ovarian cancers. You may recall in an earlier episode, we spoke about mutations as one of the triggers for the development of cancers. So here we have a specific trigger that leads to this particular type of cancers, call them BRCA1, BRCA2 mutations. And these tend to run in families. In 2002, Herceptin was made available to treat some types of breast cancers. But listen to the price. The cost was £91,640 based on 3 weekly doses of 3.6 milligrams per kilogram of that drug for 12 months. It is now emerging that the use of Herceptin for 9 weeks may have a better health outcome than the £91,000 you'll be paying for a year. I leave you to decide how to interpret that data. There's a newer drug on the market called olaparib. It's a new drug for treating the same types of cancer, familial breast and ovarian cancers. It inhibits or prevents cancer cells' DNAs from being repaired, preventing them from growing and spreading while leaving healthy cells unaffected. NICE, which is the National Institute for Health and Care Excellence, one of the governing bodies that determines what drug is available on the NHS, refused to make this drug available on the NHS because of its cost. The cost was £2,317.50 for 14 days of treatment. In the USA, the same drug has been available since 2014. With olaparib, 67% of patients are alive after 7 years, whereas only 46.5% of those treated with placebo. Does it make sense to use this drug? It would seem so, but is the price exorbitant? It is. Let's look at the impact of pricing of these drugs. We go back to the story of Sister A and Sister M. In the case of Sister A, the disease was kept a secret. No one knew except her husband. She only presented for care after the cancer had erupted and took over her breast with the formation of an ulcer. Her only available treatment then was a toilet mastectomy and palliation. That is essentially removing the breast and keeping her comfortable until she passed on. Sister M, though, was actively involved in breast self-examination. She found a lump in her breast and had it investigated. The histology confirmed the presence of a cancer, identical to the type that Sister A had. What is the difference, I hear you ask? Sister A departed from this life within 6 months of her diagnosis, whereas Sister M is still here 4 years later with no signs of ever having suffered from that disease. In Sister A's case, the cancer had already spread throughout her body before she sought medical help. In fact, in one of her final conversations, she was overheard telling someone that she was so short of breath that she felt that she had just gotten to the finish line of a marathon. Sadly, she had gotten to the finish line of a marathon. She was right, but just 38 years young seemed an early passage from this life. In Sister M's case, the cancer had been picked up early while it was still confined to the lump. She was treated and now she is well. The moral of this story is that the earlier a cancer is identified, the better the chance of effecting a cure. Sister M is still here. At Phillip Academy, we aim to try to keep you cancer-free by providing you with useful nuggets of self-protection. But should the protection fail, we urge you to recognize that early presentation is integral to a successful treatment outcome. Breast cancer is the most common type of cancer in the UK. It is most diagnosed after age 50, but can also occur in the younger age group, as was the case in Sister A, who died at 38. It can occur, and hear this, in both men and women. So not because you're a man for you to think, well, hey, I haven't got a breast, so I'm excluded. You do have a breast, and yes, you can in fact come down with breast cancer. I'll give you some figures. Though breast cancer is much more common among females, it has also been found to occur among males. One woman is diagnosed with breast cancer in the UK every 10 minutes. Around 55,000 women and 400 men are diagnosed with breast cancer every year in the UK. Though the numbers suggest that the incidence of breast cancer among men is 0.72% of the total breast cancer population, it is sufficiently high for men to take note. The median age of diagnosis of breast cancer in the UK among women is 62, though some are diagnosed as young as 45 and even younger, as in the case of Sister A, 38. Most men are diagnosed between 60 and 70 years of age. Now, we spoke about cancer and what has been happening and the fact that cancer continues to win the battle and the war. Is there any work ongoing now to try to fight cancer? The answer is yes. I present to you the top 5 breakthroughs in the fight against cancer in 2022. This is a world view. Italian scientists were able to show how breast cancer cells have been able to escape and survive treatment by hiding in little pockets in the lung. Spanish researchers have been able to use stool samples to allow for earlier detection of pancreatic cancers. German scientists have focused on the view that by cutting off the energy supply of cancer cells, they can prevent cancers from spreading. Some Spanish researchers are trying to determine whether a blood test can help to identify which cancers will respond to radiotherapy. Italian scientists, and I believe they are the most exciting batch, because they are trying to engineer immune cells to hunt and kill cancer cells, a type of immunotherapy. Additionally, just in case it may have missed us, since 1960, topical iodine has been found to be useful against breast cancer cells. I just dropped this in just for information, actually, because this is a particular treatment option that has not been used. But the evidence tells us it is effective against breast cancer cells. So probably, and it's just applying it topically, so that should be a practice that is probably more widely used in our fight against cancer. Now we talk about bowel and pancreatic cancers. It is easy to ignore obvious signs of bowel cancer if you are not aware of the significance of, for example, a change in your bowel habit. What do I mean by a change in your bowel habit? Constipation, that's difficulty to move your bowel, alternating with loose motions. I am not implying that once you have a bout of loose motion, you must start thinking of cancer. But if you observe this pattern over 2 to 4 weeks, you should seek medical advice. Something may be wrong. There are other symptoms suggestive of bowel cancer, but the most obvious clue to you may be a change in your bowel habit. There may be, for example, a sensation of incomplete emptying of your bowel, or even blood in or on the surface of your stool, or alternatively the passage of blood after you've moved your bowel. Those will all be warning signs that you need medical assistance. Bowel cancer. This cancer can be found at any location along the large intestine, including your rectum and your anus. In the USA, it is the 3rd most common cancer diagnosed in both men and women. With more effective screening and lifestyle changes, the incidence has dropped each year since the mid-1980s. This annual 1% drop is in the older age group, but frighteningly, in the younger individuals under age 50, the rate is still increasing at a rate of 1 to 2% per year since the mid-90s. So we're looking at in the mid-1980s, there has been a steady decline in the incidence of bowel cancer in the elderly age group. But in the younger age, even under 50 years of age, the incidence has been increasing by 1 to 2%. All right? Then you start wondering, are there any specific risk factors that I should be concerned about or I should be aware of? Among the risk factors are age. Any history of bowel disease, like inflammatory bowel disease, is also a risk factor. If you have a family history of bowel cancer, that is also a risk factor. And there are some genetic syndromes which increases your risk of developing bowel cancer. I hear you ask, is there anything I can do to reduce my risk? The answer is yes. We look at lifestyle factors which could influence your chance of developing bowel cancer. Among them would be lack of regular physical activity. We know that in the modern lifestyle, we tend to be like couch potatoes, sedentary lifestyle, hardly ever go out, or when you want to go from point A to point B, we jump into a car. All right? Physical activity, moving from one location to another location, reduces your risk of developing bowel cancer. Additionally, a diet low in fruit and vegetables increases your risk of bowel cancer. Low fiber and high fat content in your diet will also increase your risk of bowel cancers. And we'll see that when we talk about what we see in Hungary and Uruguay. Diet rich in processed meats is also a risk factor for developing bowel cancer. And strangely enough, obesity Smoking and alcohol consumption all add to your risk of developing bowel cancer. We look at bowel cancer distribution in the UK. 44% of bowel cancer in the UK are in females and 56% is in males. 43% of all new bowel cancer cases in the UK are diagnosed in people 75 years of age or older. The incidence of bowel cancer among blacks and Asians is lower than their counterparts in the UK. In the USA, though, the incidence is reversed. So in the USA, we find a higher incidence of bowel cancer among blacks and Asians than among Caucasians. Why, I hear you ask? Is it a racial thing? Maybe instead of looking at the race, we should look at the socioeconomic status and the type of nourishment that our socioeconomic status allows us. What does red meat ingestion tell us? We spoke earlier about Uruguay and Hungary, but now we introduce Argentina. We find in Uruguay and Argentina the rates of breast and bowel cancer are among the highest in the world. The main type of meat consumed in these countries is beef. In these two countries, the consumption of beef rank first and second, respectively, in the world. Hungary had the highest overall rate of colorectal cancer in 2020. Here there is a heavy usage of red and processed meats. The lowest incidence of cancer is found in India. India consumes the least meat in the world. This is strange because I never knew that until I found out eventually that that is the case. The foods consumed in that part of the world is also a little more spicy. So are we saying then that spice may help to provide some degree of resistance against bowel cancer? It may well be. What are the symptoms to look for in the case that we suspect we may have bowel cancer? As indicated before, a change in your bowel habit, alternating between constipation and diarrhea. The sensation of incomplete emptying, blood in your stool, and bleeding from the back passage after a bowel motion. Abdominal pain simulating trap wind. In fact, anytime you have what they call IBS-like symptoms after age 50, you need to have an investigation of your bowel, because that could be an indication that something is wrong. Okay, bloating, a sensation of fullness when you are not actually filled, would be a warning sign that there might be something wrong. Unintentional weight loss and easy fatigability may also point in that direction. So we talk now about pancreatic cancer. Of the three types of cancers discussed in this section, pancreatic cancer is the deadliest. Why, I hear you ask? The answer is simple. Whereas the other two types of cancers discussed, breast and bowel cancers, produce arguable, visible signs early in the process, which allows an individual to present for medical care, the same cannot be said of pancreatic cancer. Generally, a patient diagnosed with pancreatic cancer dies within 6 months of the diagnosis. This is so because the signs and symptoms of disease which help us in making a diagnosis presents late. The disease has already spread by the time we present. Additionally, the location of the pancreas makes surgical option quite challenging, hence limiting the options for care to chemotherapy. The data tells us that about 95% of people with pancreatic cancer die from it. Among the earliest signs of pancreatic disease is abdominal pains piercing right through the back, a sign that can easily be ignored with deadly consequences. This type of cancer is hard to treat and hard to detect. In modern practice, once diagnosed, affected individuals have an average only 6 months to live. I don't know if you recall Steve Jobs of Apple fame and Patrick Swayze, the dancer from Dirty Dancing. They both lost their lives to this disease. It is the 5th biggest cancer killer in the UK and the 3rd leading cancer killer in the USA. Therefore, Spanish researchers' analysis of stool to allow for an earlier stage of detection of this condition is particularly encouraging. What are the risk factors, I hear you ask? Among the risk factors, bear in mind that this is not a complete list of risk factors, but those which can help you to steer you in the right direction include alcohol consumption, red and processed meat utilization, gallstones and gallbladder surgery, age. Over 47% of people are diagnosed after age 75, smoking, obesity and family history, pancreatitis and diabetes, And interestingly, it is less common among individuals who have a blood group O. What are the signs and symptoms, I hear you ask? Among them are digestive problems including abnormal stools, nausea and vomiting, pain in the upper abdomen and back, a loss of appetite and sudden weight loss and jaundice. And if you're diabetic, high sugar levels would be an indication of pancreatic disease. This is the end of Cancer, episode 3. You have been able to explore the signs and symptoms of 3 common cancers. You're aware of factors which increase your risk for the various cancers. You are better prepared to know when something is not quite right and when to seek medical help. You have been introduced to the top 5 cancer findings of 2022. And you have recognized the need to seek medical attention early to obtain the best possible outcome. You are aware that bowel cancer is now rising among young people, so screening is increasingly important. To that end, there is a national bowel cancer screening program in the UK available to everyone between ages 60 and 74.